Welcome back. Let's talk some more about naloxone, commonly known as Narcan. That's the drug that can save a life when someone overdoses on opioids. Unintentional overdose deaths have nearly tripled over the last 3 years in Oregon, and state lawmakers are responding. They want to make Narcan easier to find. If the bills passed and are signed by Governor Tina Kotek, you could start to see Narcan all over in a lot of public places, businesses, libraries, even schools. Think of AEDs that you now see in the public places. Well, Narcan could be added right next to those. And one bill would allow teachers and school staff to use the drug without a parent's permission if they think that a student's overdosing. On Monday, we asked you for your thoughts about these proposals, and most of you agreed it's a pretty good idea. Rosie said 100% for making Narcan visibly available in schools, libraries, bars, etc. Perhaps a training campaign about when to use it, what to react to. Sarah agreed, definitely it should be available everywhere. We even heard from a man named John who said that he studied naloxone several decades ago and says expanded access would be a good thing.
I just saw your article or your discussion of the naloxone issue, which is kind of weird because I actually worked on it and naltrexone when I was in graduate school back in the early 70s. Naloxone is an amazing drug. It's very, very safe and should have been out there years ago, decades ago. There's no reason not to have it, and people should not be afraid to use it. Use it early as people start to nod off, because you can wake them back up very quickly, and you can really save people's lives. So we should do it now. Thanks.
And thanks for your call. I'm always amazed by the knowledge base of you viewers that are watching, so thank you for that. The package of legislation would make naloxone legal to have and use without a prescription. The state would buy the drug in bulk for a cheaper price and then offer it at a discount to anyone who wants to have it on hand. We heard from another viewer who says cost is a huge barrier.
Regarding Narcan, we had a person knock on our door the other night. My friend is overdosing. If I could afford Narcan, I could have had Narcan, but it is just too expensive to have on hand. I heard sirens about 15 minutes later. I hope the man made it, but I haven't heard. They got to make Narcan affordable. That's all I have to say.
I'm told it's about $75 to $150 for a dose of that Narcan. An addict in recovery also left us a message saying that she's considering having naloxone on hand for the exact situation that Sue just described in that last voicemail.
I'm a recovering addict. I've been clean for decades now, but I've lost many, many friends through overdoses, and I think the Narcan is just a great thing to have around. I was even thinking of getting some just in case one of my neighbors ODs or something. That's just a wonderful thing to just have a nasal spray. It's so easy. You don't have to inject it or anything. Anyway, I'd like to see it in schools and everywhere.
Well, we did receive a few emails, mostly shared the same message against the legislation. Robin said, I don't think we should be providing naloxone for drug overdoses. We should be teaching drugs are wrong and kids be afraid to try them, and work more on getting illegal drugs out of our country instead of putting a Band-Aid on the real problem. So not everyone's on board. But a lawmaker we spoke to says there is bipartisan support for the package in the legislature. We'll wait to see if they can get anything passed and signed into law. We'll let you know. There's one more part of legislation here in Oregon that's also being considered by lawmakers in Olympia, and it concerns these fentanyl test strips that people can use to see if drugs they're about to take contain deadly amounts of fentanyl. Right now, they're illegal because they're considered drug paraphernalia. Proposed bills would change that. One Washington mother who lost a child to overdose is pushing for the change, and she wants to take it a step further. That's coming up next when The Story returns.